Your anti-malaria drug is not taken morning and night. You heard me clearly. It's not taken morning and night. One morning, then one in the night is wrong. Okay? Follow me. Let me put you through on how to use correctly an anti-malaria medications. While at work, several people has complained to me that the anti-malaria they bought actually did not work for them. The question is, why didn't it work for you? Recently, while I was at the pharmacy, a woman came to me with her child of about 6 years old, a female, and they come along with one expensive anti-malaria they bought. She complained bitterly that she has used up to four doses of this medication, and they are not seeing any improvement in her daughter's health. All right. Then I asked her, okay, how did she take the anti-malaria? She said they gave the daughter one tablet to be taken morning at night. Immediately, I knew there was something wrong here. Alright, I needed to know that there are several factors that can affect the effectiveness of the anti-malaria drug that you are taking. And one of them is how you are taking this medication. As you know, there are several anti-malaria medications that are available at the pharmacy. We have like Lonax, we have like Amatem, we have Coltal, and so many other brands. All these ones I mentioned contain drug that is called Artemata plus lumenfantrine. There are other brands like Pialaxine, which contains dihydroartemisinin plus piperacin. We also have like Camosunate, which contains amodiaquins and artesunate together in them. All these ones I mentioned are known as artemisinin-based combination therapy recommended for the treatment of uncomplicated malaria in Nigeria. There are several other ones, but in this video we are going to focus on the drugs like Amatem, Lonart, and Coartem. The first thing before going to buy an anti-malaria medication is to find out if actually you are having malaria parasite in your blood. Yes, you have to do a blood test to actually confirm if it is malaria that is causing your symptoms. Otherwise, there is no need for anti-malaria medication. Some people will conclude that it's malaria even without doing a blood test, simply because their symptoms is consistent with the one when they did the previous treatment. Why that is not totally wrong, that can actually be false. Basically, the dosing of anti-malaria medications is by weight in kilogram. So therefore, you need to know the weight of the person taking the anti-malaria drug. Most adults weigh above 35 kilograms and therefore are required to take anti-malarials that contains Artemata 80 mg slash lumenfantrine 480 mg. That is those anti-malaria that comes by 6. Children who also weigh above 35 kg will also use these dose. However, other children, like those people who weigh above 25 kilograms but are below 35 kilograms, are going to use by 18. Children between 15 to 25 kilograms, so we're giving 40 to 40 milligram strength, that is by 12. Children below 15 kilograms is given a tablet of 120 milligram strength per dose. So when you have gotten the right medication, the right anti-malaria, here comes where most of you makes mistake: the dosing interval. That is when you take the first tablet, when are you going to take the next one? Remember that anti-malaria is supposed to be taken for 3 days. Now at day 1, let's assume you bought the medications in the morning. You take their first dose by 8 a.m. So the second dose is required to be taken after 8 hours. 8 a.m. should be what? 4 p.m. People make mistake of going to take that one around 8 p.m. or thereabout. That's very wrong. Now, what about the third dose? Now, the time interval between the second dose to the third dose should be what? 16 hours or 24 hours from the first dose. So, first dose from time 0, then second dose after 8 hours. Now, the third dose should be 16 hours from the second dose or 24 hours from the first dose. So, starting from the fourth dose, you are required to take it by what? 12 hours interval. I hope you got that now. Alright, so please share this video and let's get to your family and friends. I know many people are making these mistakes. And guess what? When you do not take this medication in the right way, you end up trying to treat malaria again after 2 to 3 weeks. It's because the first one you took actually did not work. The parasites were not cleared from the bloodstream. Alright? So like this video and share it with your friends. Thanks for watching. See you some other